So you're done with your procedure, and now you have questions about what to expect now that it is done. So initially, the day of the procedure, expect to go home and want to just sleep. You had some narcotic, you had some anxiety medication, there's inflammation in the nose, your body is going through just the healing response and you're going to be exhausted. So go home, take a nap. When patients get back home, sometimes the numbing medication that we use to get you numb for the procedure starts to wear off. There are some patients that will have some pain. Everyone is a little bit different. Many patients have no pain at all. Others have more pain. It's kind of hard for us to predict, considering we basically do similar type of procedure in most patients. But that's why we give you the pain medicine. So if you have some extra pain, take the pain pill. If you don't need that, you could take Tylenol instead and just relax. You're gonna feel congested for two reasons. One, there's swelling from us being in your nose. The swelling will go down over the next several days and several weeks, but the congestion, feeling like you have a sinus infection, feeling like maybe we didn't do anything in there or you're not better, that's expected and that's normal until we see you for your post-operative visits. Because what we do is, one, you have swelling, and then on top of that, in order to prevent any scar tissue from forming, we put some dissolvable packing in your nose. It's not like that old school pack at 6 feet that we have to pull out of your nose. It's just some dissolvable stuff that helps with bleeding, prevents scarring. And because we put that in, we essentially block off the sinuses that we've already opened up. So you're gonna be doing a lot of irrigation. We'll have you pick up that Neomed sinus rinse that's in your information packet. You can't use that too much. So 2 times a day, 3 times a day, 4 times a day, just irrigate your nose. We'll see you 1 week after the procedure. We'll look in there, and at that point, we'll start removing a little bit of that pack. The debridements, which are those office visits to clean out the nose, they're nothing like the actual surgery. So very easy. We put some cotton in your nose, just get you numb, sits for 3 or 4 minutes, we pull it out, look in, do some suctioning. The first visit, we don't take out a lot of the pack because, like we said, the point of that is to prevent scar tissue. We really want the linings of the sinuses to start to heal before the majority of that comes out. It's during the second visit, a week or so later, that we'll really get a majority of that out. And then as the pack comes out, then you really start noticing the reduction in your coughing, your postnasal drip, your sinus pressure, whatever your main symptoms were that led you to have the procedure in the first place. You should start noticing resolution of those symptoms at about week 2 or 3. Some patients might notice it sooner. There is bleeding after the procedure because we are in the nose, opening up some of the tissue. It's expected. We have patients put cotton in their nose afterwards just to catch any of the drainage that might be coming out of there. Normal bleeding is anything that's not soaking the packs faster than every 5 minutes. So if 6 minutes go by and those packs aren't soaked, that's all within the realm of normal for the first 2 or 3 days. You just switch those out as needed. If you're not having a lot of bleeding out of the nose, you just leave it alone. And that's it. So recovery really isn't too bad. Once the pack comes out, you'll start doing a lot better. Most patients struggle the most, if they're going to struggle at all, the first 1 or 2 days after the procedure. It's normal to have some nasal crusting up to a month afterwards because the little cilia, which are little finger type microscopic projections in the nose that move mucus and are part of the normal nasal physiology, those kind of go into shock for the first couple weeks after the procedure. So that's why that Neomed rinse is really important to keep the nose flush, especially even once the packing is out. A lot of patients will be on that for at least a month, 1 or 2 times a day. All right, hope this answers some of your questions and concerns and quells some of your anxiety before the procedure. We do a lot of this, and we're always here for you. After the case is done, you get my personal cell phone number, so you can call me 24/7, any questions, phone call, text, I'm available for you, okay? Hope this helps, and we will see you again soon.